says farewell to thinning patches and bald spots once and for all. A cutting-edge drug named PP405 could be the natural hair regrowth solution millions have been waiting for. Hair loss remains a troubling issue for countless individuals around the globe, deeply affecting self-confidence and overall well-being. For decades, people have turned to various remedies, from oils and special shampoos to chemical-based treatments, hoping to slow down hair loss or revitalize their scalps. Yet, most of these options only offer temporary fixes, rarely targeting the actual biological reasons behind hair thinning and balding. But here's where it gets truly groundbreaking. Recent scientific research, detailed on clinicaltrials.gov, reveals that PP405, a drug developed by Pelage Pharmaceuticals, has the potential to awaken dormant hair follicle stem cells and trigger natural hair regrowth. In a controlled Phase 2A clinical trial, participants who applied PP405 consistently each day for 8 weeks saw impressive results. Some even experienced over a 20% increase in hair density. Unlike well-known treatments such as minoxidil or finasteride that mainly serve to slow hair loss, PP405 acts directly at the source by reactivating hair follicles that had previously gone inactive. Thinning hair can affect anyone, and a doctor's insights into stopping hair loss for both men and women underline the urgent need for solutions like this. The trial also reported very few side effects, since PP405 focuses its effects locally on the scalp without significant systemic absorption. For those struggling with thinning strands or noticeable bald patches, PP405 offers a scientifically proven, reliable option for achieving thicker, stronger hair and sustained regrowth over time. So, what exactly is PP405, and how does it tackle bald spots? PP405 is a topical medication specially formulated to target hair follicle stem cells that had stopped functioning. Various factors, aging, stress, hormonal shifts, and even environmental elements can cause these crucial stem cells to become dormant. When these stem cells fall silent, hair follicles shrink or cease producing hair altogether, leading to thinning or complete baldness in some areas. What sets PP405 apart is its ability to directly reactivate these sleeping cells, restoring their natural productivity and allowing hair follicles to restart their healthy growth cycles. This contrasts with many traditional treatments that mostly focus on preventing further shedding or enhancing scalp blood flow, rather than addressing the biological root cause. By stimulating these dormant stem cells, PP405 encourages follicles to generate entirely new hair strands naturally. Participants in clinical trials reported seeing new growth even in spots that had been bald for extended periods, making PP405 a truly unique therapeutic breakthrough for both androgenetic alopecia and general hair thinning, affecting men and women alike. How does PP405 manage to wake up inactive hair follicles? The secret lies in its ability to boost lactate levels in the scalp. Lactate serves as an essential energy source for dormant stem cells, providing them with the fuel needed to resume hair production. Increasing lactate availability energizes these stem cells, helping them regenerate hair follicles and produce fresh hair in areas affected by baldness or thinning. This cellular-level mechanism is fundamentally different from conventional treatments that rely mostly on hormonal changes or scalp stimulation. In the Phase 2A trial, participants not only saw hair regrowth in thinning spots, but also in previously bald patches, proving that PP405 can renew scalp health and restore natural hair volume. Regular application of PP405 supports ongoing follicle activity, promoting steady and durable hair regrowth rather than short-term thickening or surface-level coverage. Looking at the clinical trial results, 78 participants treated with PP405 daily for 8 weeks showed remarkable progress. About 31% experienced over a 20% boost in hair density. Most users also noticed improvements in hair thickness, texture, and overall scalp coverage, signaling a fuller, healthier head of hair. Side effects were minimal thanks to PP405's localized scalp action, and the drug's safety profile appears strong for long-term usage. With these promising outcomes, Phase 3 trials are slated to begin in 2026, aiming to evaluate PP405's effectiveness on a larger group and over a longer period. If these forthcoming studies confirm the benefits PP405 could revolutionize hair loss treatment by offering the first option capable of reactivating dormant follicles instead of simply concealing hair loss symptoms. Why does PP405 signify a potential game-changer in hair loss care? Most existing products primarily concentrate on slowing down shedding or boosting blood flow to the scalp. PP405, however, targets the biological foundation by reawakening sleeping hair follicle stem cells, enabling the hair growth cycle to resume naturally and sustainably. Being a topical solution adds to its appeal, as it poses minimal risk for systemic side effects, making it a safer choice for long-term application. By restoring follicle function at its core, PP405 offers a straightforward, effective, and sustainable approach to reclaiming fuller, more vibrant hair. Its focus on cellular rejuvenation ensures that the hair regrowth is genuine and long-lasting, rather than just a fleeting cosmetic improvement. Though PP405 isn't widely available just yet, early clinical evidence is incredibly encouraging. Should Phase 3 trials validate its promise, the drug could transform hair restoration for millions globally. This breakthrough could allow users to regain thicker, healthier hair without resorting to invasive surgeries or complicated treatments. Its unique capacity to revive dormant follicles and tackle the underlying biology of hair loss offers new hope, especially for those who haven't found success with existing therapies. As research continues, PP405 might soon become an accessible, safer solution for lasting hair regeneration. Both dermatologists and patients eagerly await its broader release, viewing it as a potential new gold standard for hair loss treatment. Rather than relying on temporary band-aids, PP405 moves the field toward authentic, enduring solutions, while enhancing hair texture, shine, and scalp vitality for lasting confidence and well-being. When can we expect PP405 on the market? The timeline remains uncertain since clinical trials are still ongoing. Though early results fuel optimism, obtaining regulatory approval is often a long, complex process. Estimates predict it could take up to 5 to 7 years before PP405 might become widely available. This drug invites us to rethink hair loss treatment. Could waking up dormant cells be the ultimate key to solving a problem that affects so many? Are we ready to move beyond short-term fixes and embrace solutions that heal from within? Share your thoughts or experiences with hair loss treatments in the comments. Do you believe PP405 could be the breakthrough it promises to be?